Hello everyone. Today my presentation topic is a quantitative analysis of language changes during COVID-19. As Erica said, I completed my dental school and I had 2 years of clinical experience in India. And my interests are artificial intelligence and medicine, data analytics, and decision modeling. Now I'm doing my internship in spring 2022. I was working in this research study under the supervision of my faculty advisor, Dr. Lisa Weiser. My journey with her in this study is memorable, and I want to thank her for this opportunity. Just giving my learning objectives for this internship was I learned about the literature review and the entire research process, completed the CTI training for the 2 modules, and I learned how to apply for an IRB, how to integrate the informatics to research, and learn the programming languages for analysis. Just giving my overview of my presentation, I'm going to discuss about the study background and its importance, aims and objectives, overview of the study process, methodology, participant procurement process, data analytics, and challenges and lessons learned. The WHO defines the health as a state of complete physical, mental, and social well-being, and not merely the absence of a disease or infirmity. As we all know that the severe acute respiratory syndrome, coronavirus, spread around the globe, and it impacted each aspect of health. It caused physical, mental, and social illnesses. As mental health declines, it results in changing behaviors, including the language people use. Health status affects the behavior, including language. People with pre-existing mental illness and the substance use disorders have been negatively impacted by the pandemic. People with the trauma history are more affected than others. When they experience subsequent traumatic events, they can experience a similar APNS called as adverse post-traumatic neuropsychiatric sequelae. These APNS, as traditionally classified, include post-traumatic stress, post-concussion syndrome, depression, and it also includes the regional or widespread pain. It is particularly important to monitor people with the trauma history for APNS during and after subsequent traumatic events like COVID-19 pandemic. Most of the mental health studies often rely on information collected through the personal contact with the researcher, but some recent studies have shown the utility of language data from social media or other digital sources for studying some mental health conditions, including depression and anxiety. 2020 and 2021 will be remembered as the years of most significant global pandemic. As coronavirus increases, it left a trail of destruction in its wake. Hundreds of thousands of lives lost, millions of people affected with the disease, and the global travel and trade disrupted. It may be due to direct contact with the virus or due to any indirect factors like job loss, death of loved ones, isolation, social distancing, and the closure of the educational institutions, workplaces, and entertainment venues forces the people to stay in their homes and often negatively impacted the social and mental health. However, the pandemic is not just a medical phenomenon because it is also affecting the individuals and society through the anxiety, stress, stigma, and xenophobia. Why I think this study is important because according to the Owen and some of the researchers, it is estimated that 86% of the refugees globally suffer from the post-traumatic stress disorder. But traditional clinical screenings for PTSD and other affective disorders like depression require the patients to sit with a professional healthcare provider and answer a series of diagnostic questions. However, this technique doesn't apply to the low and middle income people for at least two reasons. Because one of the reasons for scarcity of professionals psychiatric care in refuge camps, and the other reason would be the resource constrained settings. The second reason, it was mainly because of the cultural taboos and deeply embedded stigmas associated with the mental health problems. In this study, I will be going to use the language and social media that is from the Twitter to identify the temporal changes in language related to self-reported depression, anxiety, and post-traumatic stress disorder in the context of COVID-19. The main purpose of this research was to explore the commonly used words and the new words, as well as the expressions embedded and emerged during the COVID-19. As a part of this study, I will be collecting the data streaming posts originating from the United States from March 24th, 2020 to March 24th, 2021, and comparing these posts with the posts from the comparable period in 2019 to attribute the effect of COVID-19 on people's social media. Following the study aims to provide the insight regarding the people's social concerns and language changes. By leveraging the social media data, I formulated three main research questions. For analysis of each research question, my main research questions are: how does the language change during the pandemic in people with trauma history? And how do demographics like gender, age affects the language during the pandemic in this population? And how the factors like illness, job loss affect the language? Here is the overall methodology of the study, starting with the participant procurement process and direct them to an online survey. And the next step would be the collecting the language data using Twitter handles to extract the tweets and analyzing it to interpret the results. Right now, I submitted an application to an IRB and waiting for their approval. As soon as it gets approved, I will start with the participant procurement process. Participants in this study are UNC students and employees of any age above 18 years. They need to complete a short survey including demographics, anxiety, and trauma questions. We will also obtain their Twitter handle. I will obtain their tweets from January 2019 to present and analyze their survey response. I will send them an informed consent regarding the study. If they are willing to participate in the study, they will be directed to the page of online survey questions. Flyers will be posted on UNC campus, and procurement emails will be sent to the CHIP program email list. These will be viewed by the thousands of potential participants. So we expect to able to enroll 200 to 500 people, because there is no direct contact with the subjects during the procurement process, and the subjects choose to participate on their own initiative. And the subject's privacy is protected. Some of the possible risks of the participants is they may feel uncomfortable, or because of some survey questions, or potential loss of confidentiality of data. Participants will not directly benefit from this research, but others may benefit in future, as we can learn how the language changes in response to the traumatic events such as COVID-19 pandemic. I designed and created a short survey using UNC Qualtrics. Survey questions may include the demographics like age, gender, anxiety screening questions like generalized anxiety disorder, and the trauma questions. Subjects will be directed to a Qualtrics online survey for the main screening questions. The estimated time for completion of this survey would be 10 to 15 minutes. To be eligible, they must be satisfied the two main criteria. That is, the age should be above 18 years, and the other criteria is they should have Twitter and they will be using the Twitter since 2019. In order to obtain the permission from the custodians of the data, I opened a Twitter developer account. The handles will be linked to the Qualtrics survey data separately from their responses. And the Twitter data can be identified with only the participant ID that is linked to the Qualtrics survey data. Both the investigators, like I and my faculty advisor, Dr. Weiser Lisa, will have an access to the Qualtrics server, and I will be maintaining and analyzing the Twitter data using a secure password-protected UNC chip program file server, to which my faculty advisor will also have an access. As soon as we collect all the data, I need to collect the language data, like words commonly used during COVID, during 2020 and 2021 periods. As I had a professional background in dentistry, I do have an extensive knowledge in medical terminology, but no programming skills. I learned how to write a code in R and Python, learn different statistics for the analysis. I prepared a draft for the data analysis, like what kind of analysis need to perform in order to answer each my research question. Using these data sets, we can study people's use of new words and phrases during the pandemic. As soon as I obtain the data, I will be using the linguistic inquiry and word count, a psychometric validating language analysis for determining psychological and personal characteristics of text. Identification of language and its change can be done with these LIWC categories. And this LIWC validator analysis tool, it was developed by Pennybaker and Chuck in 2007. Its goal was to determine which aspects of writing about negative life experiences could predict the future health improvements. Over the past 30 years, many studies, including some of them by Pennybaker, have shown the sharing of the emotions affects the people's physical and psychological health. This software can be used to monitor the language use in text sources, as it utilizes the word count strategy, classifying over 2,300 words. And it may include emotion, cognitive processes, content areas, and the dimensions may include like articles, prepositions, pronouns, and psychological processes. For example, positive emotion, negative emotion, and cognitive processes, which cause the use of causation words like self-discrepancies, relativity words, for example, time, verb tense, motion, space, and LIWC is organized hierarchically such that the word being classified as sad or negative emotion. My learnings from this internship are, I located and reviewed many literature on COVID and language use, as well as the psychology of language use related to the trauma, depression, and anxiety. And I identified a need or a gap in the literature and prepared many drafts for the motivation of study based on identify I need, and I formulated research questions and defined the data sets and analysis methods. And I also identified the appropriate research articles for manuscript submission and prepared drafts for the study methods based on the research questions, data set, and analysis methods identified. I completed CTAI training for all the required modules for research, like biomedical research and research ethics, learned everything required and prepared and submitted the master protocol and other files for an IRB and the application to an IRB, created flyers for the procurement process for the participants of the study, prepared survey questions and built a survey, and learn the programming languages. Now I will be started the data collection as soon as my IRB application is approved. And most of the challenges I encountered during this process is while to have the director access, I opened the developer account. I got delay with the developer account. So that is the main challenge. Thank you everyone for active listening.